in Laurel, Maryland, just miles away from the nation's capital, was Forest Haven. Forest Haven was first thought to be a forward-thinking institution. It was on an enormous campus over 200 acres, and many residents didn't even know of its existence because it was so far hidden in the woods.
When Forest Haven first opened, residents were taught a variety of valuable skills, such as milking cows and tending to crops, skills that would help them after they left Forest Haven.
At first, people had glowing reviews, but soon care turned to neglect. Forest Haven became plagued with a multitude of problems such as understaffing, overcrowding, lower budgets.
Medicine and treatment evolved to provide better care, but Forest Haven did not. With a minuscule budget, Forest Haven was forced to end all educational and recreation programs.
As care rapidly deteriorated, the number of people admitted skyrocketed. People were misdiagnosed and wrongfully sent to Forest Haven. Some of the people wrongly sent to Forest Haven included the blind, the deaf, the illiterate, and non-native speakers, all simply because they were misunderstood or considered a burden to their families. Located nearby was an orphanage that closed in 1974. 20 of the orphans were sent to Forest Haven rather than be sent to other housing. The dehumanizing conditions continually got worse, but all complaints of abuse were ignored. Patients would be chained to beds, verbally and physically attacked, starved, and neglected. Many residents entered being able to complete simple daily tasks, including making their bed and cooking simple meals, but regressed to the point where they are not able to do any of that. Few residents ever saw their families again and were virtually forgotten. Some residents would enter and never see the sunlight ever again. In a one-year span from 1989 to 1990, just a year before it closed, 10 residents died, an alarming death toll considering only 250 people resided there at the time. An estimated 3,200 people entered, and there were 387 deaths recorded. That is a 12% death rate, making Forest Haven one of the deadliest institutions. But if all records were found, that death toll would likely be higher.
After years of lawsuits and court cases, on October 14, 1991, Forest Haven finally closed. 66 years of torture and pain, a haunted past still remains. Only fragments of information were released, so many questions were unanswered. Since many of the residents were forgotten, their identities still remain unknown.
Today, hundreds of patient records remain left behind, forgotten like the residents.
The causes of deaths remain a mystery, most likely due to the heinous conditions and treatments. Another rumored cause of death was aspiration pneumonia because the residents weren't fed properly. Bodies of the deceased were carelessly tossed into unmarked graves. Each grave was marked with a number which corresponded on a list with names but was never found.
In 1989, before Forest Haven closed, families of former residents purchased a granite headstone to commemorate the hundreds who perished.